One of the most important concepts about the environmental theory that as nurses we use today is the importance of maintaining a clean environment for the patient. Nightingale stressed throughout her theory how important it was to maintain a clean environment for the patient. Clean room, clean linens. It was just all about preserving cleanliness. I think that today one of the most important factors is washing our hands. We live this in this since 2020 with the pandemic. We know how important it is to wash our hands to prevent cross contamination. One of the biggest factors that I can think about when it comes to the environmental theory and how it changed education is that Nightingale, her primary focus was on the patient and the environment, with nursing interventions aiming at manipulating the environment to help the patient recover. Um, Another of the biggest influence that we can take away from this is that she changed nursing education. We talked about how important it is to keep the patient and the environment clean. The importance of aseptic technique. I think this is something that throughout the years we will always come back to this, as this is one of the bases of nursing care. How did this theory, the environmental theory, influence nursing research? Well, one of the first things that we can go back and see in the past is how Nightingale used her knowledge, put two and two together. She saw that the environment in the hospital it was dirty, it wasn't clean, and how that was contributing to the patients dying from infections, diseases, instead of their wounds. So she is one of the first nursing theorists, as she and utilize statistics to find out that the reason the soldiers were dying was because of the deplorable conditions of the hospital and not because of their wounds. So how can I use the environmental theory in my daily activities at work? I work with an orthopedic surgeon. So as a surgeon, he is very strict, as he should be when it comes to sterile technique and aseptic technique. Those are very important. Now we can see patients from the ages of 10 up to 100, and we do multiple types of procedures there. We do intra-articular injections. I have to help the PA or the MD, and you have to maintain sterile and aseptic technique. Obviously, this is very important to prevent an infection. So that's one way that I can use the environmental theory to remind me, to manipulate my environment to make sure that I clean the room, I clean the trays, I wash my hands to make sure that I don't cross-contaminate. We can have multiple patients throughout the clinic, in one day and doing multiple types of procedures. So I always have to make sure that I take the time to go wash my hands. Make sure that I take the time to clean the room thoroughly between procedures. Now, how can this theory help a new nurse to come into a setting like the setting that I'm working? Well, simple. I think the main thing that you can take from this theory is the importance of aseptic, sterile, and avoiding cross-contamination. So the nurse that coming into a clinic like mine can always use this theory to avoid cross contamination. Going from one room where you just did an intra-articular injection to another room where you might have a patient that has a septic knee. You have to make sure that you take the time to wash your hands. You take the time to clean the room. I think that is one of the biggest things that a new nurse could take from the environmental theory coming into working into a setting like the setting that I work at.